Shannon. I am the program director of the Women's Residential Program here at Akua Mind and Body. I've actually been here with the company since we opened about 3 years ago, and we started off with a detox and then opened up with an intensive outpatient program, and I was a therapist there. And then I became the women's director when we opened up our residential program almost 2 years ago. And I am now a licensed marriage and family therapist, and I'm very passionate about topics that have to do with shame. I lead a lot of groups around that topic, and one of the things that has to do with shame is also depression. And so I want to talk today about how do we conquer depression. So clinical depression is 5 or more of these symptoms. So the first one is depressed mood. So that's if someone is feeling sad most days for about a 2-week period, and you see them, they're tearful. The second one would be anhedonia, so that's lack of pleasure in most things that used to give them pleasure, and that's also for that 2-week period. So all these symptoms that I'm going to be talking about are for a 2-week period, and that would be considered a clinical depression. And so then also weight gain or weight loss, a considerable amount, and then also insomnia or hyperinsomnia, so someone who actually sleeps too much, and then also fatigue, and then restlessness, and feelings of worthlessness, or excessive feelings of guilt, inability to concentrate, or suicidal ideation. The tough part about depression is that the very things that actually make you feel better and actually get you to get better with depression actually are the things that you don't want to do. Here at Akua, we actually pride ourselves in working in a psychodynamic approach, which means that we actually do find where the origin is of these negative thoughts. We figure out what that underlying issue is that's leading to the substance abuse and substance dependence, leading to that anxiety, leading to that depression. We go underneath and that eating disorder. We work with a lot of women that do have eating disorders. Even though we're not an eating disorder facility, we see that come up a lot in the women's facilities, because once you take away the substances, then their negative cognitions about their self-image is coming back up because they're not numbing themselves anymore. So a lot of these things are important to address with a counselor. Thank you so much for taking the time with me, and I really enjoy doing this. I'm very passionate about this, and I hope that word gets out that we do help people with mental illness.